So for the College of Health in nursing, we have minimal changes, but they're important changes. What you see up here is changes to the Masters of Nursing. So first of all, I would like to go through the generalist program. And recall the master's program has 3 pathways. It's the generalist, it's the family nurse practitioner, and also the nurse educator. So with our accreditors, we had met with them, and in order to just sharpen up our program a bit, we did some changes. And if you've been with Davenport long enough, you will notice a course that has been unarchived, which is the 765 and 765C. It's Concepts of Advanced Nursing and Clinical. That has been a course added to the generalist. And an advanced capstone class, which is 797 and 797C. So that is actually a new course. So the first course is unarchived. It's a clinical and a didactic, as well as the capstone class. What we removed from the generalist program, because it was very confusing to prospective students, as well as our accreditors, we removed the role of the educator, the last course for the master's program. So, and what this did not change any of our credit hours. We just rearranged credits, and I'll show you that coming up soon here. So program changes then in the nurse educator. We barely get this launched off, and we're already making program changes. Yay, but that's all good. So, and also the postgraduate nurse educator. So we added that same clinical course. It's the Concepts of Advanced Nursing and the Clinical. We reactivated that course. And then to the nurse educator, we changed the credit hours in order to even out between the other clinical course and this clinical course. So to recap, both the generalist will have 2 clinical courses, and the nurse educator will have 2 clinical courses, as well as a post-grad certificate will have these 2 clinical courses. Is that confusing? We'll ask questions later. I think that's okay. Okay. All right. So the Masters of Nursing prerequisites and co-requisites, they're listed here. We wanted to make certain that they have health assessment, advanced patho, and pharmacology before they start these courses. And you will see 738 would be the last 3 Ps that we talk about that they would need to take before they take 765, as well as the clinical. So they just basically match each other. Okay. And as far as the co-recs for the role of the educator, they just need to have that first clinical done before. So it's, in essence, if you follow the sequencing that's on the website, you should be golden. As well as the prereq for the clinical for 787C. Lastly, I just wanted to do a little plug in for our BSN. We have a new program, or excuse me, a new cohort starting winter of 2020. What that is we'll have a cohort seat of 32 students here at Lettinga that will begin nursing courses winter 2020. So yay, that's very cool. Also, I just wanted to give you a brief update on BSN concurrent partnerships, and we continue to work and grow each one of these community colleges with these students. And right now, we're with Delta Community College, Northwestern Community College, Kalamazoo Valley, Montcalm Community College, and West Shore Community College. I need to read those off, just make sure I'm not missing one. And we're currently working with Alpena Community College, Kirkland, and Mid-Michigan Community College. All of these for either our concurrent program or our completion program. And then we have one hospital, Mid-Michigan Health System, that is beginning a cohort on campus, on site, for our completion program. So just a couple little tidbits there. I don't have very many things for me. I don't know if you want to wait for questions later or now.
It's okay if anyone has questions about nursing for Amy. Any questions here in seat or online?
That's scary.
Well, there's a delay. There's a 1.5-minute delay for the live stream.
1001.
Well, thank you very much, Dr. Staley.
Thank you.
And now remember, as I announced at the beginning, Dean Karen Daly is stepping in. Linda Sorensen, due to the bad roads, was unable to be here. So she's going to cover some of the HIM and allied health information.
Okay. Yes, I am not Linda. So she sends her regards, and if we need to, we can phone a friend. So I would say I know a lot of this, but I do not know everything that Linda Sorensen knows. So I will do my best, and if we need her, she is waiting, and she's listening right now, nodding like this, going, yep, she can call me. Okay, so Allied Health and HIM. They've done a lot of really great work in trying to streamline and condense and really focus the curriculum in both of those areas. And so one of the things we looked at is where are we using courses, where are we not using courses, how do we need to stack and change prerequisites? And you'll see that reflected here. So for medical assisting, we went through and revised the program learning outcomes. Many of you don't see those, but they were very lengthy. And we used the best practices that Irene has communicated with us that really are the right way to do things. And so we condensed those learning outcomes. If you would like to see them, let us know. But they're much more readable and focused and measurable. So that was one piece. And then we had these specialties for a long time and no enrollment in those. So those were deleted as well. And you'll see them on the next page: chiropractic, ophthalmology, and phlebotomy. And those are the course numbers. And then in medical case management, and you may recall that last year we did a lot of getting rid of courses, pulling courses together, condensing courses so that we didn't have random courses covering the same thing in health and HSAT and medical case management and HINT. So when we did that, we needed to make sure that we were sort of changing the way we were doing things in terms of prerequisites and content. In addition to that, we've been working for a year now on feedback that came back from a consultant in about September of last year. We went to our advisory boards, we went to our stakeholders, and we really vetted what do we need to do to update medical case management and make it state-of-the-art. So it took us a year, but all those changes went in, and the bulk of what you're going to see is reflected there. So for medical case management then, we deleted nutrition and health economics because our stakeholders told us those were less important than increasing the reimbursement and quality insurance information, and that's Health 250 and Hint 209. So we believe that better reflects the state of the art for case managers. So we moved it there. Before I read this to you and tell you about it, I do want to let you know that the MSHIIM was just fully accredited in December. We have our certificate. Our first visit for accreditation was last summer, and we're fully accredited, so we're really, really proud of that. But they had feedback for us, and one of the pieces was that we should make sure that all of the students have medical terminology, anatomy and physiology, patho, and pharm as prerequisites. So Jeannie Freeman is the program director. She can evaluate someone's curriculum or experience and decide whether or not someone's experience shows they have this information, or if they have it on an actual transcript. So just know that we may have students looking for those courses in order to meet CAHM standards. But if they do have those courses and that information, they can sit for the RHIA, which is one of the HIM credentials, after completing their master's. So they could come in from a different discipline, take this master's, and get this really great RHIA credential. So I think it's an important change. Here are the list of specialties that we eliminated. As much as we would have loved to have helped our colleagues in chiropractic, ophthalmology, and phlebotomy, we just weren't getting enrollments anymore, so it was something that had to be done. So these are the courses that you'll see. And then we did some course name changes. So as I said with medical case management, we were really trying to bring it up to where it needs to be and meet the standards for the Commission for Case Management Certification. So ultimately what we're always trying to do with these students is make sure that when they graduate, if they get the proper experience, they're eligible for certification. And in order to do that, we had some changes we needed to institute. So for this one, we changed the name to insurance utilization and discharge planning. We had not been covering discharge planning for the medical case manager, so we needed to add that. For medical case management 401, casework is not the proper term anymore, so we had to change that to case management documentation and reporting. The documentation piece is now key, that we add that in terms of electronic health records, and so we wanted to make sure they had that additional information as well. So for the certification, case management certification preparation, we've gone through and revised what we do based on the 2016 certification exam. And then for this course, we had to take a look at our outcomes and revise those as well. Okay, so revised course descriptions. This was a lot of work. Thank you to Kim Coursey and Linda Sorensen and all of those folks. We really had to go through and really reword and contemporize and update and make sure these were appropriate. So you can see these different names that you're familiar with, but then at the bottom, and this was actually a request of some of you, we went and we formally asked for Health 101R and 101S to be changed. You all had told us that Health 101R needed to include reentry and repeat students, and that 101S used to say reentry, and so we changed that wording to select transfer students. So I hope that addresses your concerns, but let us know if there's anything else there that we need to move forward on as well. Okay, so prerequisites. Okay, so we were trying to make sure that we had the right prerequisites. Some of what's happening is our lovely online students, as you know, like to schedule themselves. Because I know all of you are following our program sequence sheets, but they're scheduling themselves and they're arriving at a practicum without the proper coursework. And so in order to help degree plans see that and help you, and automate that a bit, we put in 4 prerequisites. So for the practicum, here's the courses that they need to have completed. The practicum has to be done in their last semester. Associate department chair approval, which we already do. And then this is something that I think is really important, especially based on recent experience. Usually we ask them to be in contact with us a semester ahead of their practicum. For medical case management, those sites are more rare. And so if students can get to us at least 2 semesters in advance. Also, if the students can be pretty verbal about what it is that their preferences are, where they would like to go, why they came here, what is it they're trying to accomplish, if you can encourage them to do that, that helps us place them better. Co-requisites then that are acceptable for them to be taking while they're in the practicum are these two, 402 and 403. Same thing with 312. This is the one that we added discharge planning to. Insurance utilization review and discharge planning, and some courses that are helpful to be prerequisites for that as well. And some more prereqs. So for Hint 209, a prerequisite is Hint 215. That's that mini one-credit math course. And that's for HIT and HIM majors only. Or the prerequisite for 209 is Health 210 for HSAD majors. What we had done was we had to remove Hint 203, even though we had deleted that course last year. We didn't go through the catalog and take it out everywhere it was listed as a prereq, so we're just fixing that. So it's nothing new, but it is, we're fixing something that we hadn't fixed enough of last year. For both 294L and 294, the prerequisites then are these three things, 221, 222, and 250 for both of those. Okay, so we have been working with Kelly Wandell on trying to make sure that we have a seamless transition for community colleges into our health programs. In previous years, it could take you 140 to 150 credits to get your bachelor's degree if you came to us from a community college. So we really took a look at that, and again, the faculty did wonderful work of really looking at how we can streamline completion programs, because Kelly's insight, Kelly Wandell's insight, was that they weren't picking us because it was too much, too many courses, too much money, et cetera. So we took a look at that, and we came up with, in health services and medical case management, 3 different ways that you can get into our program. So if you're an associate degree allied health professional, an associate degree nurse, or a licensed practical nurse, we now have completion programs for you in HSAD and medical case management. So we listed some of the degrees that are allied health. It is by no means exclusive of these. Certainly there are other associate degrees that would qualify for this. And Linda told me to write in caps, please ask us if you have someone coming in and they wonder if they qualify for this, go ahead and call any of the allied faculty. But specifically, Linda said, please call her and ask if you have a question. So what this looks like is, and you see it on your handouts, we transfer in 60 credits. And remember, a lot of these allied health community college programs are 76 and 82 credits, and they were complaining that we weren't giving them credit for their credits. So we can only transfer in 60. We took some time to really look at the accreditation standards, the licensing standards, the certification standards, and compare it to our curriculum. And we worked with content experts to figure out if they passed the exam, what did that mean? They knew. And that we were able to go through and grant in advanced standing with the permission and the watchful eye and the careful guidance of the registrar. And then that leaves a number of credits to be finished. So for this one, for allied health, it's 60 credits transfer, 13 credits in advanced standing, and 47 credits to a total of 120. Saves them time, it saves them money, and they'll hopefully pick us over someone else and go through one of our wonderful programs. So same thing with the ADN articulation. We were hearing that the nurses, some of the nurses wanted to go into health services. So it's 60 credits for transfer, advanced standing, and an unencumbered nurse's license. Amy's giving me the evil eye. Excuse me, Dr. Staley. And then 44 credits to be finished to total 120 credits. And again, they sat down with Amy and Kelly and went through and really looked at this and what was required in order to decide what the advanced standing credit would be. And for LPN articulation, we're hearing a lot that the LPNs want to go on. So that GPA is a GPA of 2.0. We'd grant 46 credits of transfer. They get no advanced standing because they're going to need a lot more credits in order to go ahead and get their bachelor's. And then if we move forward and we look at medical case management, it's essentially the same. So allied health and human service articulation is 60 credits transfer, 10 for their license, maybe they're a respiratory therapist, 50 credits to be completed, and not more than 120 credits. And for the ADN, it's the same, 60 credits transfer, 16 advanced standing, 47 to be completed at 123. So that's a little bit higher. And for LPN, 46 transfers, 0 in advanced standing, and 77 credits to be completed, 123 credits. So in addition to doing all of that work, so you can see my faculty have been very, very busy. They also took a look at the HIM program and modeled after what nursing did with their advanced standing for the nursing program and the completion program. They were able to sit down and figure out that there was about 30 credits that could be granted. Now these HIM or HIT degrees are typically anywhere from 70 to 80 credits at the associate's degree level. So what did they have, what did they didn't have, what did their passing of the test indicate to us that they knew? So 60 credits transfer, 30 credits prior learning or advanced standing, and then 33 credits to complete. And we're getting some traction on this in terms of getting people to come into our HIM program. Then the other thing that we heard from all of you, so this is off topic a little bit, but I think it's worth going over, is how the heck do you get all of what you just said, Karen, into DegreeWorks? So we've met now a couple of times with the registrar, and he recommended that we bring this to you. And what he's telling us is that when you're going to look at a degree plan for these students, you need to use both the program code and the concentration code. So understand that in curriculum committee, we didn't ask for a concentration or a specialty, but when the registrar transcripts these, they come out with a specialty. So you're not going to see these specialties listed anywhere. It's just the way that it has to be done in order for the DegreeWorks to read it correctly. So for instance, in health services with an associate degree in nursing, you can see there's a program code, there's a concentration code, and as you go through, the program code is the same, but the concentration code is different if it's an associate degree allied health. For medical case management, same thing. So we had an instance, the way we learned about this, other than Kelly telling us it wasn't working and she was working on it, and you guys saying, what are you doing? This isn't working. We had a student try to sign up for one of our programs, and she closed the browser when she saw she had to sign up for a concentration. And we said, no, come to us, please sign up. So we do listen and we try to learn and grow. So we're hoping this will help you. So as we go through this, then Chris Marks asked us to give you information on how to run the DegreeWorks. For instance, for HSAD with practical nursing, the degree is Bachelor of Science. See the academic year. You see that it's a completion. Health services, LPN completion, and that you have to mark that the concentration is practical nursing. And so as we go through these, the same thing. The only thing that really changes is, the major and the concentration, and to stay on top of those. So I thought that would be useful for you to have. And so we can go through. This is the allied health specialty, medical case management, medical case management and nursing, medical case management and allied. So, any questions or concerns? Do I need to phone my friend?
Yes, my question would be, would there be an advantage to any of our associate degree HIT students to then just complete the associates, take their RHIT exam, and then just do our completion program?
I suppose they could, yes. Hadn't thought of that, Gloria. You're always good at reminding us. Linda can type something if she's now on the other end of this going, no, no, no. I'll let you know. But yeah, I mean, I guess that's one way around it, certainly. Typically, what we were looking for more is an experienced person coming in that's out working in the field and is coming to us for the first time. So that's a good question. I will ask and get a little bit more information about that.
Just waiting for Linda Sorensen. She's typing for those of you on the live stream. We're waiting to hear her response to the question.
Okay, her response is they need the RHIT credential because the credentials count for many other credit/courses. She says no issue as long as they have the RHIT.
So what you're thinking, let me see if I'm hearing what you're not saying. So we could have a very interesting student who looks at this and says, I'm going to finish my associates here at Davenport. I'm going to sit for the exam. And when I come back in the fall, I don't have to take any of that other stuff. Is that what you're saying? And I only need to complete those last few credits. Is that what you're thinking they would be thinking? Okay.
That is correct, and I work with a lot of those students, and I've been promoting it, so I'm glad this really is okay, because my students are just ecstatic about being able to sit for the RHIT, and they're really looking forward to that, which is a nice change, and then coming back for to finish the completion degree. So.
Right. Okay, and I mean, remember, our HIT program is what, 72, 76 credits, depending on how you do it. So, I mean, giving them 60 credits is sort of one of the things people argued with us about. Why can't you give us more? Well, you all know why we can't give them more, because of residency. So we were trying to make sure that all of these credits were DU granted. So interesting. Thank you, Barb, for being on top of that. Other questions?
Typing more.
All right, so no issues. You just can't go into the completion with the associate degree without the RHIT. The RHIT proves the student has entry-level skills required.
Okay. All right. So if she has a long list of things that I got wrong or I didn't say, those will go out to you all in an email. As I'm pinch hitting for her, I'm happy that she's home safe because the roads were pretty treacherous today. And one more time, congratulations for Dr. Staley.
Woohoo! Thank you so much, Karen. We really appreciate you being here today. Thanks for stepping in.